Hey, this is Dr. Jason Dean, and I wanted to come to you because actually something happened that's not supposed to happen. Now, the last couple days, I actually woke up and I had like debilitating low back pain. And you're probably gonna say, he's a chiropractor, he's not supposed to have low back pain. They handle low back pain, right? Well, I did have low back pain to the point where it was actually trouble. I had trouble walking. I was getting up and I was like kind of like stumbling, and it was really bothering me really bad. So I want to tell you what actually happens. If you haven't noticed, in society today, everyone has one of these things. It's called a cell phone, right? Well, I love my cell phone, I love my technology, and I did something that I usually tell other people not to do. But even though we're chiropractors and we're doctors and we know the dangers of the radiation that's coming out of these things, I was unintentionally actually sliding this in my back pocket because just convenience and things like that. And I had been doing this for a couple months and really kind of almost forgetting I was doing it, wasn't even really paying attention. I would just slide it back there. Now recently I have gotten a case for this, and I have an EMF, basically a reflector in here that protects me. But I only had that in the last probably month. Before that, I had been going probably 3 months or longer of sliding this phone without the case and without protection into my back pocket. And actually yesterday, the pain was so bad that I had a massage therapist working on it. I got adjusted as well, but what happened was, with the nutrition response testing we do in our office, very laser precise muscle testing, we actually found out that I was testing for radiation in my lower back, or actually where my sacrum or tailbone are. So this is just kind of a public service announcement. I just want to let you know out there that the worst places you can carry these phones and take it from somebody who's supposed to know better and actually did it himself. We're not really supposed to have these on our body all the time. I usually have it away from me, but I was unintentionally sliding in my back pocket too. But radiation over a long period of time can be anything from pain to long-term. They've correlated and connected to cancer, and the cell phone industries actually have this information, but they don't put it out there. It's in like kind of the back room on all the labels and everything that you don't read, because we know this is actually happening. So not only for myself, adults like me and chiropractors and teaching our patients, but also what I see out here is a lot of teenagers, kind of that millennial generation, is they're carrying it in their back pocket, but also ladies are carrying it right here in their blouses and their bra area. And now we have this connected to the breasts, which could be long-term breast cancer. So I actually just want to kind of give this to you as a gift almost, because even myself is not immune from this mistake sometimes of putting it in my back pocket. And I want you to just be aware and cognizant that you might be doing this with yourself and with your own phone. And let's try not to do this anymore. And especially to the kids, their body's still growing, you know, everything's changing very fast. We don't want to throw the hormones off by having this in their back pocket or in their front pocket next to the reproductive system, or up in the chest area, especially from women. So I just want to let you know about that and kind of give it to you as my own mistake. And my back pain is actually getting better now that I'm getting it handled and getting treated in our office through massage, nutrition, and chiropractic. But I want you guys to stay healthy. Take that little tip. Cell phones, keep them off you as much as possible. And when talking, use speakerphone as much as possible. So Dr. Dean with a little bit of health tip for you on cell phone and radiation. Go take care of yourself. Thanks a lot. Take care.